Let me do the case management first, because there are more intriguing figures that Ghanaians believe want to know. We now have people in isolation and for treatment. For Ga East, a whole hospital that has been dedicated for this exercise, we have 50 cases on admission at Ga East. As of yesterday, new admissions that were put there were 5, and we discharged 7 from Ga East yesterday. So total number of discharges now stand at 38 discharges. These discharges are on home care. They have had first repeat tests, now waiting results. They are not ill. We've tested them negative. We've taken samples to do the second test, now waiting results. We've checked their homes and continue to observe self-quarantine as we continue to observe them. So they have been discharged to go home. We'll continue discussing and engaging them. The 79 from the quarantined travelers, we have virtually transferred all those that were positive, with the exception of one person at Accra City Hotel. He was supposed to be transferred yesterday for triaging, and it's very likely that person may also be discharged even after we take to Ga East for triaging. That's that. All those that are quarantined, we've taken away the 79, so those who continue to be in the hotel are all negative. I have written letters sent to them on individual basis. The letters were personalized from the minister to each single one of them. We have thanked them for their cooperation and understanding. And we have announced to them, I'm going to go and announce that they are all negative. But by quarantine protocols, we have earlier informed them that they will stay the whole 14 days. And since the 14 days is getting closer, some have been here 10, 11 days, we will start take samples for repeat tests on them today. We expect that between now and by Thursday, we'll have had the samples taken, tests done, results released, and by the 14th day or early morning 15th day, all of them will be released to go home. I've assured them in the letters that I've sent to them that the Minister of Health stands by to facilitate and assist them to take their luggage home when we discharge them after the 14 days. The government applied the coaster bus to aid staff transportation. This bus was delivered yesterday. A pickup has also been given to medical superintendent at Ga East to enable him organize logistics and around to make sure that the case management team, the doctors and nurses are facilitated to do their work very well. We still have 4 cases on admission at Rage Hospital, the Greater Accra Rage area. Repeat tests have shown still positive, so we continue to keep them there. The doctors have started giving them hydroxychloroquine 2 days ago. We started reviewing their situation. Anytime we get negative repeat tests, they also will be discharged. On mentioning hydroxychloroquine, I just want to inform the nation that the laws of our country allow the health minister to issue what we call emergency use authorization to FDA to allow or permit manufacturers and importers to bring in drugs that are not on our drug list. That exercise has been done, issued authorization, and FDA has, on that note, permitted some manufacturers in country to bring in the active pharmaceutical ingredients, APIs, or even import if they can source from outside to augment the stocks we have in country. At the moment, we have enough stocks to take care of all the people we have on admission. 37 military hospital, we still have one case. Home care, I've told you we are discharging, and we have 20 from the regular community screening awaiting repeat test results. So when you are diagnosed positive and they start treating you and looking very well, to be sure, we continue to do repeat tests to begin to show negative, then we stop observing. But for now, those in home care are being observed. Doctors are talking to them, they are visiting them to make sure that they are taking their prescriptions. A number of cases on home care in Accra are now up to 58. The 38 discharged and the 20 that have been discharged earlier. There are 2 patients who may release who have tested negative on 2 consecutive occasions also in Accra. Kumasi, there is no case on admission at the moment. The only case we have there opted for home care, and the doctors have allowed that. So he's also in home care. Konfanochi Teaching Hospital. There's a case on admission. Repeat tests showed negative. But later, I think on the test, it showed positive. I've put that person on hydroxychloroquine. We are waiting results for repeat tests. Obuasi. The first case, there are 2 cases. For the first case, we are doing repeat tests and it's showing negative. The second repeat test, again negative. So the doctors seem to have accepted that the person is old now. For the second case, who was also in contact with the first case, tested positive. 12 contacts have been identified along that line, and they are in self-quarantine at the moment, also in Obuasi. Obuasi has 2 home care cases. One has been put on hydroxychloroquine. While there is 1 case, again home care. There's 1 contact with that person, and we are waiting test results. Tamale, there are 10 cases. They start treatment today. The Interior Minister is working with the Foreign Minister to try to see if these people can be taken back to their countries, their authorities. But that process diplomatically has not been completed. And they are under order from the President to let them get back to their country. They entered our country illegally when borders had been closed. And so if you are found, definitely you have broken laws and you have to be taken back to your country. UGMC, University of Ghana Medical Center, that is ready for use. Training has been completed. There are 14 beds for holding area and 14 beds for treatment. 5 ICU beds are also ready. So we have UMC dedicated again some part of the facility to put in patients. Bank of Ghana Hospital. I kept on telling the community, the people in Ghana, that the Minister of Health hasn't got direct jurisdiction over Bank of Ghana Hospital. And people were blasting that there are hospitals completed that will not be utilized and all that. We have had engagement with Bank of Ghana, and they have released 2 floors to take care of 20 beds for our use. Because the facility doesn't belong to the Ministry of Health, Bank of Ghana has agreed that their own people and some VIP personnel will be allowed there. So in case we get some of you here, VIP people, we are likely to take you to Bank of Ghana Hospital. Why are you laughing? You are all VIP people. In material, okay. So I'll call the fact that we are ready to take people in and make sure they are getting well. We are also arranging to disinfect areas that we quarantine people, and when we evacuate and the places become empty, we have made arrangements for disinfection to be done before we hand over the facility to the owners. Let me now move away from case management to look at why we have been asked to stay home. So the surveillance report for this morning. We have recorded 105 cases with 5 deaths. The number of against reporting cases remain 5. Greater Accra, Ashanti, Northern, and Upper West. The Greater Accra region has the most cases, 174, followed by the Northern region, 10, Ashanti region has 9, Upper West region 1, and Eastern region 1. Most reported cases now are from routine enhanced surveillance activities. Cases from travelers under mandatory quarantine remain 89. That means that we have taken all their samples, we have got those positive, and those negative are still in hotels observing the mandatory 14-day quarantine period. Cases from travelers under mandatory quarantine remain 89. That is Tamale 10, Accra 79. Whereas cases from routine surveillance currently stands at 106. Accra 95, Kumasi 8, Obuasi 2. As at 08 hours this morning, I'll summarize it in a tabular form. General surveillance 106, travelers undergoing mandatory quarantine 79 positive in Accra and in Mali 10. So the total figures: recovered and discharged 38, discharged home management 49, those in treatment facilities 138, dead 5, so we have total reported cases 195. Let me go over again, because it's very important, the type of explanation my colleague and younger brother Kwaku tried to explain. I will stress, there is no policy as yet for compulsory mass testing that people are just parading and trading in on social media. If anybody amongst those managing COVID-19 team had gone on there anywhere or even on social media and has said that we are doing mass testing in some communities. Please, this should be corrected now. It's correct that we have teams that are working now in Accra and in Kumasi for what we call contact tracing. It's like those who have been tested positive. They had contacts with people. Those who traveled in country before the quarantine are already in communities. We have got a tall list of them with their contacts, telephone numbers. And from the database that we have, almost all of them are in Accra and Kumasi with isolated cases across the country. These are the people we are trying to reach. And when we get to them, each of them, we will try to take samples from that person and transport for tests. But if we meet one of such people and he's living with a wife and children, maybe in a very good self-contained 2-bedroom or 3-bedroom house, they are also contacts. So there's a need to try to test the very immediate contacts that he has come in with. If he's living in a compound house, the tracers will ask them questions. So those in the compound house who have had contact with that person definitely have contact, and they will also be tested. That does not mean that if you come and you are living in NT49, and all the people in NT49, about 5, your family people, have tested, and that person and none of them had gone to NT48, we are not going to test anybody in NT48. This is the explanation. So the contacts will continue from contact to contact. But if you have not had any contact and they don't have evidence to suspect you, there will not be any sample taken from you. And that is not mass testing or compulsory testing. So we are only checking on contacts. So far we have deployed several teams in Accra and Kumasi. They are working now. And people that are being contacted are cooperating very, very, very well. And we believe if you are able to do this exercise successfully, the chain that we want to take will get broken and we'll have no challenges in our country. That is the exercise we have mounted. The necessary materials and logistics that these teams need being given. They are going around with security officials and immigration people and disease control officers, the epidemiologists, the field officers. They are all part of the teams that are moving. And we believe that with your cooperation, things will be okay for us. We'll continue to give updates on the type of numbers they are reaching up to. In Accra, we now have 140 teams in the areas that we have demarcated to actually trace people in. So far, between Monday and today, they had contacted 635 people and 589 samples have been taken. They have all been sent to Noguchi. We also started testing in Kolebu, the infectious disease reference laboratory. So the test will now become a bit larger and results will come a bit earlier. In Kumasi, we have deployed 40 teams. They started a bit late yesterday, but they have contacted 160 people and they have collected 22 samples. We are pushing them to up their game today so that they can get closer to the targets we have set for them. Things are working for us. The good news is that some people are being contacted on telephone to try to find their locations, and they are also cooperating. Yesterday, somebody called me and praised government on the efforts that we have put in so far. The person came in earlier, before quarantine. He had been called on telephone, contacted, they've given her, she should go for her sample to be taken. She went there, they took her sample, and she was so happy awaiting the test results. Not just one isolated case. So the contacts, the physical one-on-one, can be on telephone, but we request that Ghanaians should cooperate with us, and we believe we can break the chain and succeed in the efforts that we are making. The president is so solidly behind us. He's in almost every meeting the team attends. He's chairing the interministerial meet committee that he has set up. The old man is not sleeping. Thank you very much.